Thank you for being with us. We begin at 5 o'clock now with expanding COVID vaccine mandates around the Portland area. You can add the Rose Quarter to the list of places now that will require guests to be vaccinated. That includes Blazers games. Starting September 4th, you'll need a COVID shot to attend games and concerts at Moda Center. Fans will need to show their vaccination card or a photo of it. If you're a fan who can't get vaccinated, you'll need to bring proof of a negative COVID test, and it needs to be taken within 72 hours of the event.
So far, I think majority of the feedback we've gotten has been overwhelmingly positive, which is nice to hear and affirms our decision.
Masks are also required for all spectators. This vaccine mandate also includes the Portland Winterhawks at Memorial Coliseum. Their season starts October 1st. Head coach Mike Johnston said, "We, along with the Rose Quarter and the Portland Trail Blazers, all agree that the health and safety of our community is a top priority. All fans and staff will also need to wear face masks, and purchases will be cash-free." Students across the metro area are heading back to the classroom full-time in the next couple of weeks. Joe Ranieri talked with one elementary teacher about the safety protocols they're taking this year.
Summer vacation is slowly winding down for Jesse Cheney.
The children. Being here and being with them and helping them and just being around them. I'm most excited for that.
With 2 weeks until her kindergarten class starts at Bridgeport Elementary in Tualatin, she's spending her last days of summer getting ready to roll out the welcome mat.
I feel like we know a little bit of what we're doing. We've had a little bit of practice. We know how to wear our masks. So it almost feels pretty normal.
This year, she'll have students right in front of her.
I think we're all concerned, which is normal and we should be, but we've done so much work. And we're following the research and we're doing everything we need to do to keep kids safe. And that's our number one priority.
Students are going to be spaced apart from one another inside the classroom and throughout the school. And kids are going to have to get used to wearing a mask.
The kids have to wear their masks all day, and so do all the teachers and the staff. So we'll be fully masked the whole day. And we'll be having our special distance, so we don't get to sit quite as close as we used to.
Recess will be scheduled so only one class is out here at a time. And once back inside,
we are washing and sanitizing hands upon entering the school, before lunch, before snack, after recess, when we leave. All day long, we're washing and sanitizing hands.
While students will be back for class this year, the Tiger Tualatin School District is offering an online learning academy for parents who might not be ready to send their young kids who are too young to get vaccinated back to class.
What I'm finding is that for a lot of parents, they're really clear on what it is their student needs. They might be really clear that online is the best option for them, or that being in person is the best option for them.
No matter what the start of the year looks like for students,
I think that we're going to rock this. I think we're going to do great.
Teachers like Jesse Cheney are already looking forward to the first day of school.
I'm not quite ready to hang things up on the wall yet.
In Tualatin, Joe Ranieri, KGW News.
At least 4 districts in Oregon have had to delay the start of the school year over surging COVID cases. Here's a look at a list right now along with new start dates. Delayed districts include the Alsea District in Benton County, South Umpqua High School and Elkton Schools, both in Douglas County, are delayed. So is the Culver School District in Jefferson County. Portland Public Schools are planning to start on time. Hospitals in Portland and Southwest Oregon are nearing capacity as the Delta variant continues to spread rapidly. Admins and nurses from various hospitals made more pleas today for people to get vaccinated. The hospital system is getting overrun with COVID-19 patients, and the vast majority of them are unvaccinated people. They say the healthcare providers are getting burned out, and right now there are over 1,000 people in Oregon hospitals with COVID-19. Last November, at the peak of that surge, there were only 622. Hospital admins in both Oregon and Southwest Washington expect this surge to last another 10 days. They say it won't level off until October.
We've got a few weeks ahead of us where things are going to be really all hands on deck as we take care of our community. And then it should, the numbers suggest it should start slowing down and reversing, and we should see less patients in the hospital.
Hospitals around the state are also warning of staffing struggles amid the COVID surge. Members of the Oregon Nurses Association say they're getting frustrated with the problem and fear the new vaccine mandate for healthcare workers could make it worse. In the Peace Health system, for instance, as many as 810 workers could be on unpaid leave by the end of the month if they don't get vaccinated.
We want some answers and accountability on how conditions were allowed to deteriorate this bad 18 months into a pandemic. And I think the hospitals, all the hospitals in the state and the regulatory agencies are going to have to answer to these nurses.
Nurses also say there were already staffing issues even before the pandemic hit. To help alleviate the problem, Governor Brown is sending extra resources to places dealing with the worst COVID surges. Reinforcements featuring nurses, paramedics, and other healthcare professionals are on their ways to hospitals. Many will be going to southern and central Oregon counties, which have some of the worst COVID rates in the state. Up to 500 workers will be part of these hospital crisis teams. One of those hard-hit counties is Jackson in southern Oregon. Today, for instance, Jackson County reported 614 new COVID cases compared to 266 in Multnomah County, even though Multnomah County's population is almost 4 times higher. That has both current and former Jackson leaders calling on commissioners to speak out more about the COVID crisis. That includes former Medford Mayor Al Densmore.
In the medical community, we've reached an extraordinarily dangerous level, and we're just thinking that the community needs to mobilize in major ways, and our elected leaders need to help lead us into that.
Densmore did thank the commissioners and administration for their work during the pandemic. However, he says the current situation demands more action. We are also seeing firsthand just what hospitals are dealing with. St. Charles in Bend and OHSU both gave us inside access to their ICUs. You can watch our 30-minute special, Overwhelmed Inside Oregon's ICUs, tomorrow night on KGW at 6:30. And our Inside the ICU reporting is getting national attention, including on NBC Nightly News. Here's a quick snippet from tonight's show.
For weeks now, we've seen the unvaccinated packing hospitals, the new surge taking an emotional toll on healthcare workers. In partnership with our NBC Portland, Oregon affiliate, KGW reporter Christine Pitowanich takes us inside the ICU.
Hospitals in Oregon are at their breaking point.
You can watch Christine's full story for NBC Nightly News tonight at 5:30. Now, as if all of this wasn't enough, hospitals are also dealing with people who are touting unproven COVID cures on social media. One such issue surrounds ivermectin. OHSU says it has seen an increase in cases of people misusing this drug. It's often used in the U.S. to treat or prevent parasites in animals, while variations of it have been approved to treat parasitic worms and some skin conditions in humans. Research on its effect on COVID is still going and has not been vetted by authorities. The FDA says do not use it for COVID. Misusing the drug can have deadly consequences, particularly variations designed for animals, because the doses are often much stronger. We'll take a closer look at this problem tonight on The Story at 6 o'clock. Getting a COVID vaccine during pregnancy has become even more urgent as ICU beds fill up. But even though the CDC recommends it, as Christelle Kumwe shows us, not many pregnant women are getting vaccinated.
We found out in early January, and we were kind of hoping, so we were very excited.
Eva Penor and her partner Jessie found out they were expecting their first child right before the COVID-19 vaccine became available. Jessie got his shot, but Eva wanted to hold off.
Kind of worried, well, because there hadn't been much studies as far as pregnant people were concerned with the vaccine. So initially we were let's just wait it out.
Since April, the CDC has recommended the shot for pregnant women, although people who are pregnant were excluded from the initial clinical trials of the 3 COVID-19 vaccines authorized for emergency use in the U.S. Significant research since then has shown the shots to be safe and effective for pregnant women.
Especially when they came out and said that babies were getting the antibodies, that was huge. I was okay, well, I would love for my kid to have that benefit.
Eva got the shot last month.
It is probably the best thing you have done.
Dr. Bukosi Dube with the Oregon Health Authority says that was a good decision, especially since pregnancy increases complications from COVID-19.
What we have seen is that women who get COVID after getting vaccinated, if there were to be the rare case of a breakthrough case, they do much better than women who have not been vaccinated. And their babies do much better.
But so far, the CDC reports only about 24% of pregnant women in the U.S. are vaccinated. The percentage is even lower among Black and Latina women. Earlier this month, the Centers for Disease Control and Prevention formally recommended all pregnant women get vaccinated against the virus.
You are better off if you're pregnant or thinking of getting pregnant to get vaccinated so that you protect yourself and you protect your baby.
Especially with this Delta surge that we're experiencing right now, I think it's probably a really good idea to go ahead and get your vaccine.
Eva doesn't regret getting the shot and hopes her decision reassures other mothers-to-be.
If it's being recommended that you take it by your doctors or your medical team, I think go for it, because really ultimately you're going to be protecting yourself and others.
Christian Kumwe, KGW News.
Today, hundreds of people attended a memorial service for a fallen Oregon State Trooper. Sergeant John Burrite died in May, nearly 20 years after a crash left him with career-ending injuries. The large procession started this morning at the Linn County Fairgrounds and ended up at the Salem Armory. In September of 2001, Sergeant Burrite was helping a family in a stuck vehicle on I-5 when a drowsy driver crashed into them. Two of the first responders were killed. Sergeant Burrite barely survived. The crash left him paralyzed and with brain damage. He spent the rest of his life in a nursing home in Albany.
He was always surrounded by family, friends, and an amazing group of caregivers.
You know, several years ago, I passed the mark where I'd spent more time without my dad physically being around than I had with him. But the impact that he's had on me has really lasted through all these years.
Donations to the Burrite family can be made through the Oregon Fallen Badge Foundation. Developing tonight, police are looking for the people behind vandalism at the Lone Fir Cemetery in southeast Portland. Several large headstones have been toppled this week. Volunteer organization Friends of Lone Fir Cemetery plan to clean up that area. Of note, some people are pointing fingers at homeless campers who live nearby, but both Friends of Lone Fir Cemetery and the city of Portland say there's no evidence the campers vandalized the cemetery.